sir.
Never gets old. Good afternoon, sir.
Good morning, good evening, and good night. How about that?
It sounds good. I like it. Yeah. Did you
What's up,
recover?
you spicy little devil?
We had a competition this weekend. It was great. So it was our team did really well. A lot of go ahead, especially at the white belt level. We had some really good performances.
Are we going to call anybody out on the team
No.
for, how do you say, falling short?
No. Because I think everyone did super well. It was a tough tournament. It was a tough tournament.
Everyone that competed did super well.
Okay,
if you know where I'm going with this.
Yeah, for people that didn't show up on time and stuff like that, you're talking about.
Show up on time.
Oh,
maybe they came in a little bit of a chub chaser.
Yeah. No.
A little bit of weight management.
Yeah. No, he's gonna pay for that for the next 6 months. Don't worry about it. We won't need to do it on the podcast.
You see, I can call him out by name because I'm about 1,500 miles away.
You'll be up here again.
See him.
Yeah, but
that's true. That's true.
At your own risk, he'll wait. He'll wait for you, and he's one that you
he holds a grudge.
Yeah, and you should actually be scared.
I noticed that fat people do that. They hold grudges.
Oh man.
Now, our friend that just didn't show up on time, I like to look at him as my little Mishka, my little bear, and I'm not going to say I'm disappointed, but I'm pretty upset about it.
Yeah, he was in time for no-gi, so.
Oh, at least he did that. Yeah. So rule of thumb, if you're going to compete, make sure you're always checking if they use smooth comp or something like that. Make sure you're always looking at it, because if for some reason the 15 matches in front of you finish with submissions within a minute or 2 minutes or 3 minutes, your call time is getting moved up an hour.
Oh yeah.
So
you
always got to be keeping track of that stuff, especially for you lower belts, because a lot of the time they'll do black belts first, brown belts, so on and so forth. So if you're a white belt, maybe or a blue belt, maybe you're thinking, oh, dude, I don't go till 1 o'clock.
Yeah, we had.
Well,
I know we had blue belts going at like 10 o'clock. So
in the morning.
Yeah.
So and their initial call time could have been noon or something like that. And it's, you just got to really keep an eye on that stuff. And the whole hour early, always anticipate it's going to be more earlier than that. Like, you're cutting it real close, especially if you live any sort of travel distance away, from the big tournament. We call it the Rev up in Seattle. Great tournament, best one in the Northwest. For us, it's an hour to an hour and a half.
Yep.
Yeah. So you really got to kind of plan accordingly. So shame on you for missing your gi matches. And fat shaming works, and so does late shaming. That's what I'm here for.
Okay.
With that, everyone did awesome. You guys brought home a lot of medals, which is super dope. I have actually, with the amount of cross training I've done down here, and actually we had a tournament down here as well, and there was only a couple competitors from the school. It was pretty cool to see, like, just a different flavor, different tournament. The venue down here is insanity, dude. Like, they had a jiu-jitsu tournament going on. They had a concession, like, food court area that looks like a professional stadium, and then in the middle, so let's say if you're looking at the food court, to the right you see just a huge jiu-jitsu tournament, food court, and then to the left it had probably 20 basketball courts, and there was a basketball tournament going on, and then another 20 courts. So you can imagine how big this
Oh
place
my
is.
God, it sounds monstrous.
There was a volleyball tournament.
Wow.
So it was like an incredible sports facility that they're hosting this stuff at. But it was cool to see. It was cool to see some of the kind of my new teammates, compete and stuff
Hmm.
like that, and just to be there to support them. So
Cool.
good stuff all the way around. Chris, I
Mm,
want to talk to you about curriculum.
okay.
Okay.
Yeah.
I've been cross training a bit, obviously, new gyms and stuff like that, and trying to really figure out what kind of curriculum I like from uh, a coach's perspective, from a student's perspective. Uh, Hopefully, I hope to have my own school one day, and trying to figure out what would I want the feel and the vibe, and how do I learn when it comes to technique, right? Or learning jujitsu or something like that. And I want to know from other people. I hope people comment and give their 2 cents on this in the comments or email in. Um, and we'll read your responses if you email in. But I really hope people respond to this as we talk through it. Is what kind of class structure do you prefer? Now, let me kind of throw out a couple examples and then you can kind of tell me what you think. And if you default to exactly what Cascade does, I will reject that answer. Okay. So, um, so there's obviously a bunch of different class structures that people do, right? One is like a 15 to 20-minute warm up, whether that's maybe some sort of calisthenics or maybe that's line drills, whatever, or the really old school stuff where they do a lot of push-ups and jumping jacks and running and that sort of thing. There's multiple different ways to do those warm-ups, but about 15, 20 minutes. And then they'll do maybe 20 to 30 minutes of technical training or technique, right? Where they introduce the move that they're doing. You work that, drill that for about 20, 30 minutes. And then you get in about 10 or 15 minutes of situationals, sparring, right? Where it's not full rounds, but maybe you're starting in a certain position that applies to the technique. And that's the class. And then a lot of the time, at least down here, class is over.
Mm,
They don't do open mats after. Um, I find that to be pretty common down here.
mm.
Another one is maybe a small warm up, 20 to 30 minutes of technique. And then maybe the class is a little bit longer than an hour and they do like 45 minutes of sparring. So you can get, 5, 6, 7, 5 minute, 6 minute rounds or something like that. Still kind of smaller time frame for technical training and the drilling and stuff like that. But still getting a small warm up in, 20, 30 minutes of technical technique training, and then sparring. Okay. And then you even have a limited warm up. Maybe it's something that's more like a technical warm up where you're doing like some sort of leg drag drill or something, some sort of movement drill or something like that. Maybe more technical training within that. So like 45 minutes of drilling, something of that sort. Okay. And then maybe finish it out with a little bit of situationals and then go into sparring, kind of like an open mat after the fact, right? So the formal class is primarily drilling and technical training, and then it gets into sparring. Now, obviously, there's different ways you can mix and match that. What do you prefer?
Yeah.
I'm interested.
I'm biased, of course, with kind of the way I look at things as a black belt and as a physician. I'm really biased into the warm up being like that end range strength stuff we do, that mobility work, because not only will people get that, that's a session they can get in during the week, maybe 10 or 15 minutes. It doesn't have to be a lot, 15 at the most. but it also exposes some weaknesses when people are like, they think they're fit and in shape, and all of a sudden they can see the holes in their mobility game. Because I think for the academy, that type of initial part, that warm up, if you want to call it, or that what we do, kind of that FRS, kind of in range strength stuff, will translate hopefully into more resilience out of the academy, less injuries, things like that. And
Would you say that that's even more important to a school that is, down here, there's like, I don't want to say pro gyms, but
yeah,
there's, compared to the Northwest, down here, there's actual gyms with like Casino, Marcio Andre,
sure,
and even or like uh, Sugar Sean
yeah,
O'Malley is. So where we have high level athletes, right? Would you say that this kind of warm up with like end range kind of stuff is even more important for the non-competitor gym that has just Joe Schmoes at it that work doing concrete during the day, or you're standing a lot of your day? Maybe you work in front of a computer or something like that. You work at Microsoft. Is Would you say that kind of stuff, that kind of warm up, is even more important in those gyms?
yeah, absolutely it is, because one would argue the professional athlete, some of that stuff is on them, to kind of get strength and conditioning stuff, and they're there to do their pro level training, right? So those of us, whatever you want to call us, hobbyists or whatever, that have other lives, um, I think the stuff translates not only to injury prevention, jiu-jitsu, keeping people on the mats, but day-to-day life. I think it's enhancing for stuff they want to do outside the gym too. So
Yeah.
for me, keeping people healthy and not injured, because that's the biggest thing. You could have someone that's a blue belt and has a bad injury, and they may be done. They may never come back. And that's
Yeah.
that's a possibility for sure. So for me, I
Probably
think that,
common too.
huh?
Probably somewhat common, honestly,
Yeah, it's very
right?
common.
Where
Yeah,
someone earlier in that journey that maybe they've had a couple little nicks or
yeah,
something, but then they get something that's fairly serious.
yep,
You're just, it's easy to just pull out and be like, "Ah, okay, this is done."
yeah. And I'm very biased on this, but
Mhm.
I think it's shown some dividends for us when we've kind of incorporated this stuff. Um, you know, to start the class. Now you don't have to do that every class. There's something to be said for if you want to do some more in, getting some reps and some fundamental movements. So I think it's really good to warm up too, but kind of low speed and just working on razor sharp technique, whether you want to do arm bars and triangles from guard, you want, something to
Mhm.
kind of reinforce those fundamentals that it can also get the nervous system and, the motor skills kind of back up to snuff. But
Something that's kind of movement oriented.
yeah, yeah. Without, I think the days of looking at the warm ups as a beatdown, I think it's a little outdated.
Yeah.
If you want to crush yourself, by all means. But we've talked about this many times. I think if you fatigue the nervous system significantly before you start class and trying to acquire a new motor skills, I think you're doing yourself a disservice. In
Well,
my
think of any
in
time
my opinion.
if we tried to do a intense workout and then we go take a test of any sort.
Yep.
Your mind is just
Well,
not going to be working right.
Well, it's not just that. It's just, and especially the body, the central nervous system is fatigued at that point a bit, and
Yeah.
we're trying to upload new stuff, and so so I definitely, and so that's kind of how I would start. I
How
real
long? What would you want
At
to
the
spend on
top
that?
end, 10 to 15 minutes, and it should be targeted.
Okay.
The top end, 15 minutes.
Okay.
Um, then I really think spending a good deal of time, let's say at least 30 to 35 minutes on a technique. And there's
Mm.
more than just going through and drilling it. It's fine tuning it. It's having your black belts come around and like let's troubleshoot some stuff you're having difficulty with. That takes a little time. Not just this perfunctory, okay, we're going to do this. Here you go. Let's do a couple reps and move on. If we're going to do it, we want to really develop good habits early and fix some, biomechanical problems or anything that we see as black belts walking around to help people get more efficient and more technical. And I think that's time well spent. And then because you could drill, but if you're drilling crap, the output's crap. Do you know what I mean? Mm. You probably seen it.
100%. That's one of my things that I say is drill like you're going to do it live.
Well, that's right.
Now, sometimes you'll do it slow. I get that. But once you start to get a move, if you have like a common drill is, okay, let's do 20 arm bars, close guard arm bars. Let's do 20 close guard triangles, as a way to like get the glutes firing, the hamstrings firing, and your body moving, your torso. But when I would see people doing those reps like absolute dog shit, it would drive me crazy, Bailey, that you are not putting in effort.
Well, and oh geez, I love how you threw that in.
He's gonna message me for
sure. I don't even like doing it with reps. Let's do a time period on the clock. Some people may rep them out quicker and quality reps. Other people, I don't want to feel like they have to get their 20 reps in to keep up with the rest of the class and have them just be crappy reps. I'd rather have someone do 6 reps, just, biomechanically well.
Totally.
Yeah. So that's, that's fine as well too. But again, when we're doing a technique, especially with, we have mixed classes and we have, black belts, brown belts, purple belts, and we have a bunch of white belts and blue belts. So everyone needs something a little different, and some people need a little more attention. So I think it's time well spent to do that. And then if you have 10 minutes left over, I really do like the situational work that you've just kind of gone over, and really, and Professor Andrew says all the time, hey, let's not just revert to our, if it's De La Riva, let's not revert to our A game. Let's actually try to play the position and feel it out.
Challenge yourself.
Yeah, and the situational doesn't have to be, this 100% situational. You could go, 60 to 80%.
Totally.
Yeah.
Totally.
And so that's how I like to see the first hour. And you can plug and play whatever you want in between there. But it's a shame that, you're experiencing, and this is my opinion, of course, because I haven't grown up any other way, but having that hour afterwards of sparring, that's invaluable to me. I think that's really, really important. And it's also a time where, let's say I've done 2 or 3 rolls, and I'm a little tired and I have some white belts. Hey, can you help me out with this? That's a time to do that. And so I can kind of take a couple of people aside and we can really get down into something they want to work on, so I really like that whole, that's the format I like the best.
Yeah, I would say I totally agree with that hour after. I'm very used to that, obviously, as well, because that's what we've done up north.
Mm-hmm.
But having that just kind of free time, one, because I've heard some people, I've talked with some people down here, and they don't think that people are disciplined enough to roll during that time, that they'll just kind of BS. And he's a friend of mine, so I just disagree with that. That I think if you open it up to open mat, as we've seen, whether that's Seattle Jiu-Jitsu does the same thing. Obviously, Cascade does that. Electric does that. So these are 3 schools that I've trained at a lot. And all 3 of them do a similar structure where it's like, all right, maybe they did some situationals or some sparring of some sort. And then it's like, we bow out and then, okay, open mat, let's go. Sure, some people cut out. But for the most part, that is when a lot of the real work is getting done, because you illustrated that perfectly. And that's at that time, that's when upper belts can talk with lower belts about what they're working on. Because here's something that was weird. If you let's say we always work on something on our own, or we should be, right?
Yep.
So let's say in your class, your instructor is going over butterfly guard. Well, that's good, and you should do that in class. And if that's interesting you, then you should do it outside of class or in your sparring time. But a lot of the time, you're gonna gravitate towards whatever's kind of got your interest. Right now, before we went live, you were talking about you're doing X guard.
Yep.
So you're probably not doing X guard though in class. Like Andrew's probably teaching something else right now.
Yeah.
But right now, you have an interest in developing that part of your game. So you're using open mat as the time to do that. Now, maybe uh, you're going to consult with Andrea because she's got a good X guard. So that's going to be a time where you do those 2 rounds and you're like, man, I couldn't even establish the dang thing. Let me go to Andrea. Let me ask her, hey, what's going on here? I feel like I can't hold this hook or whatever it is. You
Exactly.
guys get to troubleshoot. Yeah.
Yep.
So
Well, and
I
and
find,
I'm sorry, Bill, go ahead.
no, please go.
No, I was saying, for instance, we had one of our purple belts about a year ago, kind of built like I am, about the same height, body type, and really wanted to work half guard. And I spent a lot of time with him kind of developing that. And, he's become just a real handful with it now, he's really kind of
Mhm.
developed that. But I think that's important to have that mentorship unofficially, when someone's really has a game that you like, hey, they're there to you can pick their brain. It's almost like a private lesson and such, where
Yeah.
but it's built into our community. We're not like, oh, you
Yeah.
can see me for a private lesson. It's not like that.
Sure.
It's
Sure.
just extra benefit, right? Like you said too. And I'm always working to refine something when I'm having trouble. I ask someone that is
Mhm.
doing it well. Yeah.
Right. And I would say even more so than that side of it, which is one, because I mean, we'll do 10 rounds, we try to hit 10 rounds in the open mat period by
Yep.
itself,
Yep.
right? That's always like kind of nice when we see a 10 up there. Um, and yes, we can get those rounds in. We can work on some technique, in between. You don't feel pressed for time that, okay, I only got 4 rounds to get my sparring in. So if we just went and you were like, dang, Bill, you passed my guard. How the hell? Like, what did you do there? We lose that opportunity
That's right.
to talk shop in that moment and try to diagnose what I did. And so you can get better. And so I can get better too, right? That's going to be a moment that
Well,
even though I had the success in that one moment, I can get better by just talking about it.
you can explain what you did and verbalizing that, you can be a really good black belt competitor and not being able to verbalize what you're doing. That's a skill too.
Right.
Right. So,
Oh,
and something that sometimes we didn't think about, like some people will take that time after class also to go back into a corner of a mat and work some of their own mobility or get on the assault bike and do a couple rounds,
oh
to
yeah.
get some of that anaerobic kind of training to finish off their training session. And Andrew's been teasing. He's pretty much, talking about making a little gym back there. It's all of that time after class for us, for me, is some of the most enjoyable, community building, and good for the jujitsu in general.
That's where I was going next. And I was gonna say, maybe even more important than all this technical crap that we're talking about,
Mm,
is that's where the culture and the community is built, and the fellowship is built in that after
yep.
class time where the team really gets to know each other. the lower belts really get to start to know the upper belts because oftentimes, and just natural, it is what it is. The Me and you have been training together for 7 years.
Yep.
We're very close. So when someone new comes in, they've been around for 6 months, it's just natural that I'm going to talk with you. I'm going to talk with Andrew. I'm going to talk with Jake, these people we've formed these relationships with. So it's easy to kind of fall into, now we try to be cognizant of that. So we try to always obviously greet and like talk to new people,
Yeah.
but it that's a time to like have that moment of getting to know the newer people and getting them into that culture that if you're at a good gym, they're trying to like stoke that kind of camaraderie, right? In a jiu-jitsu gym that kind of
Yeah.
naturally comes just by us beating each other up.
Well, and that's why it goes against, what you were saying earlier when, you're talking about, oh, well, people aren't disciplined enough to roll. Well, it's more than just that. Like we were just talking about.
Yeah,
Building that community is more than just getting in there and rolling. I mean, that's of course a big part of it, but you know,
yeah,
so yeah. So that's kind of my thought. I think you and I are
yeah.
pretty similar in what we like in our curriculum.
I I I would say a little bit. The one thing I do a little I different, I guess, and it's not totally different. It's just slight. Is I like to dedicate at least 45 minutes to technique. Part of that is, and you know this, is I'm a little bit, I won't say longer winded, but like I do go into details quite a bit and like uh which I'm not saying that's even a good or bad thing, like compared to people that don't go into details, or like I might talk a little bit more about conceptual stuff within the technique. So that just stretches out that time of, and then I really try to get people to ask questions.
Yeah, but I was just trying to do it in the constraints of an hour. Yeah, your classes typically
Right.
would go over an hour, which is nothing wrong with that. But yeah, if I had to
Yeah.
expand that time, it certainly would be the way you're doing it. Instead of like 35 minutes, I was trying to leave room for situationals and the warm up in the beginning to be
Yeah.
an hour. But yeah, if you got an hour 15, shoot, let's increase the to 45 minutes like you said. Yeah, I'm all about that. I think
Yeah.
it's really important.
Yeah. And I guess I would prefer a class not have sparring in the first hour than and get more work in technically
Mhm.
than have sparring, force sparring into the first hour and then wrap up class super fast. Now at the same time, I know my fellow gym mates listen to this podcast, or some of them.
Mhm.
I'm not talking shit. I'm not saying that it's bad how the classes are down here
Yeah.
or anything like that. I'm just saying different way to skin a cat, different flavor ice cream. My preference, and I know some people didn't prefer how I. So like when I do technical, like the technique stuff,
Mhm.
I don't like drilling for reps. I don't like to, okay, do 10 of these and then 10 of these. I think Danaher came out with a within like the Lex podcast and one of the Lex Friedman podcasts and
Mhm.
was talking about how detrimental drilling for numbers can be. And he illustrated that really nicely. But I like to do time, which you kind of just mentioned.
Yeah.
So I use 3 minutes. So
Yep.
one person goes for 3 minutes, so you can get a groove because your first couple reps suck, and then maybe you do one good rep, and then you do four more crappy reps, and then you do one good rep. So you get 3 minutes to try, and it's short enough that if you lollygag, then you're going to lose your time.
Yep.
So you kind of have to focus, and it's just 3 minutes to focus. Then you switch. Then you potentially bring people back in, answer a couple questions. Okay, where were people struggling? And instead of adding another technique, do it again, clean it up again. And as I walk around, let's say I have, like, I had an advanced guy named Tony, brown belt, and then he would maybe be training with Colby. He's advanced purple belt, right? And I might identify those guys and say, while they're the second go around, I'm gonna go up to them like, hey, this is what we're gonna do next. So I can almost get them ahead
Yeah, of course.
be- because they're more advanced.
Right.
And I think that's just being a coach that is paying attention to the room, right? And then you're gonna have maybe your first month guy going with someone, and it's like, okay, you guys, we're actually gonna retard you a little bit
Yeah, for sure.
and
Yeah.
and keep you on this for the whole class, something like that. So being fluid, I think, will also help. But I just want people to know that I'm not like talking shit or
No, I
something like
know.
that.
Well, hopefully people don't take it that way. Everyone's allowed to voice their preferences. I mean, that's all you're doing. So I don't think there's
Yeah.
anything wrong with that.
So you like to, how many days a week would you like to do that? Uh like functional range system, in range strengthening and stuff like that kind of work on a, let's say, a 6 day a week class structure,
Three,
PM classes.
three.
Three.
Yeah. I
What
think
would you
that's
like to do on the others?
some type of very technical drilling with time, not for reps, like you said, just to get them sharp, revisit fundamental things.
Like fundamental movements or
Fundamental
something like that.
movements, yes, exactly, and I think that's
Okay.
important too. Quality over quantity as far as motor skill development,
Yeah.
and then quantity comes and endurance comes once that skill is, the so-called motor memory, where you have it dialed in, and then you can
Right.
start, stringing together more and more and get more
Yeah.
endurance on that.
Yeah, maybe exactly. Like here they have at the gym I train at, Paul Nava's, they'll have a fundamentals class and then an advanced
Mhm.
class, and then the warm-up's different between the two, right? So advanced, you're kind of expected to know some basic movements. So if we're gonna warm up with just some like leg drag drills, it's like I'm not gonna show how to do a leg drag perfectly because you should kind of already know that. So let's get our leg drag drills, do them good, do them right, do them technical, throw a little intensity into it because you should already know it, right?
Mhm.
If you're still kind of refining that, then maybe slow down a little bit to
Yeah.
get that technique. But yeah, okay, that was something I was just, as going through different class structures, I was kind of wondering if I'm the only one that
No.
likes this way. Maybe there's some people that like this other way, or maybe there's something that we didn't even talk about. So that's why I hope that people comment and let us know.
Yeah.
Um, we had a couple questions come in that were injury related and injury prevention related.
By the way, before we start this, speaking of such, we had, a question several months ago. Remember the guy with the neck fracture, the odontoid fracture?
That almost killed him.
Yeah. Remember I said, "Do not mess around with that," and I recommended if you're
Yeah.
local. Well, he went and actually saw the guy I recommended he see, and
Oh,
he came up to me at Rev. Um,
oh, not the guy that had that clipped his artery.
no,
The
no,
guy
we're
that was in
talking
a bad car
he had
accident.
had the fracture.
That's right.
Yeah, he came up to me at Rev,
Oh, very
and said,
cool.
"Hey, thank you so much," because I sent him to I think one of the best spine surgeons I know, and not only, he looked at him, took some imaging right there in the office and said, "Hey," because the other guys were telling him, "Oh, you gotta be in a collar for a year or whatever," and the guy was like, "No, but this is what you do need to do," and now he's cleared him. He actually competed again. He competed at Rev, so
No shit.
yeah, so that was very cool. I just wanted to bring that up. So we had someone that actually went and followed
He
through.
competed.
Yeah, he got a silver. He actually podiumed.
I saw him a week or two after that accident.
Mhm.
I mean, he was messed up.
I know. Yeah, but he saw an actual spine surgeon who himself is a martial artist, right? And
That's
so,
incredible.
yeah, and he um gave him exactly what protocol to use and when he was safe again to train, and now he's back on the mats and competing again. So I just thought that was a good.
Wow.
I just wanted to let you know that that came up at Rev this weekend.
Does he still have a beautifully manicured beard?
It was pretty nice.
Yeah, it's full. It's full. That's awesome, man. Congrats to that guy. That is
Yeah,
super cool.
yeah. Anyway, go
Well,
ahead.
with that,
Questions.
injury prevention and stuff. So we had a question. This is someone that's local down here that approached Olivia because they had a it sounds fairly severe injury. Um, so I'm interested, and they text Olivia just kind of I think what the rundown that their doctor said.
Mhm.
So let me run through this real quick, and then you can kind of give your 2 cents.
Okay.
So they had some hamstring pain behind the knee. Uh, Supposedly, there's a proximal muscle belly distal attachments of hamstring are torn. That's what the doctor found.
Okay, wait. No, no. That sentence contradicted itself. Can you say that again?
So yeah, it's typed out a little odd.
So proximal
Hamstring
okay,
pain.
hamstring, the proximal hamstring is up by the butt. The distal hamstring is down behind the knee and attaches either to the fibula and the other head's attached to the tibia. So that's the distal.
And
You
muscle
said
belly's in the middle, right?
yeah, you said proximal and distal. So say it again.
Yeah. So how it's written out is hamstring pain slash pain behind the knee. That's what they're feeling.
Uh-huh.
And they're also having groin hip flexor pain. Now, it just says dash proximal muscle belly distal attachments of hamstring are torn. And then it says proximal gluteus medium attachment, ASIS and thesis tear.
Okay. A ASIS?
Yes,
Okay.
yes.
So there's two those are two completely different things. Actually, there's three things in that question. I would need to ask a whole bunch of more questions and see the imaging.
So,
So what
so the part of the question is the doctor said that physical therapy will not work. It will not help. You need to do PRP, and the person's like, "Well, PRP is freaking expensive. What can I do if I can't do PRP? Can I K tape it? Can I transverse deep tissue massage? Can I peptide therapy?" So that's the whole question in a whole.
well,
Now,
if the doctor actually said that, he's an idiot. So I'm just gonna
also,
say
can I just? I seen this person. They don't have any bruising. I don't
so
know if that matters or
well,
whatever, but I
so
was surprised.
so that's why there's a lot more to this story. I would need to actually see the actual imaging and things to know exactly what's going on. But based on what we are told here, so if you have a muscle belly, I'm assuming that's the hamstring muscle belly they're talking about. The hamstring is three separate muscles. They have their origin as one tendon called the conjoint tendon on the ischial tuberosity, which is the bone you sit on. It's the thing
Okay.
you're yeah, that bone you sit on basically. And you can have an attachment there, and then it spans out to divide. Biceps femoris is the lateral hamstring that attaches to the fibular head, and the semimembranosus and tendinosus are the other hamstring, and they attach to the fibula. They all pass behind the knee. Excuse me. Coming up from the opposite direction are the gastrocnemius soleus complex, the calves, and they form almost like a cross behind the knee with the hamstring tendons going the other way. So sometimes it's difficult to tell, just on first, you got to really do a good exam on which one is the problem.
Mm,
Assuming it is a hamstring problem, first of all, absolutely physical therapy with a good therapist can work wonders. Matter of fact, these protocols for that, they usually involve gentle eccentric loading, the kind of
okay.
the negative. This has gone back years and years ago. This protocol was developed for tendons for an Achilles tendon. There's the story goes there was a Scandinavian orthopedic surgeon who's also an athlete. I think he was Swedish. I'm not sure which Scandinavian country. I can't remember, but he almost completely tore his Achilles tendon as it inserts on the back of the heel. And
Oh,
he went
shit.
to his colleague and said, "Hey, can you just repair this thing?" And the guy goes, "No, not till it snaps." And so he tried to snap the thing himself.
Oh my gosh.
And in the process of doing this jumping down and eccentric loading, imagine you put your toes, your like on a stairs, your forefoot on the stairs and let your heel drop,
Hmm.
right? Like you're doing calf raises. He tried to
Yeah.
do that violently. He ended up rehabbing his tendon. So they're like, "Oh shit, there's something to this." So that eccentric loading protocol came into play. Matter of fact, we had one of our female blue belts that had this exact injury. Well, at least out the proximal where it attaches to the sit bones, the ischial tuberosity. It's exactly what we had her doing some. I actually did some electroacupuncture on her to increase blood flow, but I also had her do those look like the single leg deadlift, the bird feeder looking thing.
Yeah.
So we had her do that assisted very, very slowly, start a progressive protocol to slowly eccentrically load this tendon. And it's work, dude. And so if the doctor says PRP is the only thing that's going to help, PRP can assist in the healing process, but you can do this without that. You can
Even if there's tearing.
Yeah, of course, especially if there's tearing. So the muscle belly tear is the one you don't really have to worry about as much. And it's usually torn is what's called the musculotendinous junction, where the tendon actually becomes actual muscle proper. Um, that's usually the time. And you saw what happened to me. I tore my adductor, right? I didn't have
Mhm.
surgery or anything like that. Over an
Yeah.
well, of course, I had some assisted stuff like exosomes that my wife shot me up with, but all of it was eccentric loading in a very progressive manner, and I rehabbed it, and I did use they mentioned cross friction massage. Absolutely, you can use I used a lacrosse ball and a yoga block and laid in a frog position and did that kind of my own cross friction work to help decrease the myotatic reflex. You know, that protective response we always talk about. Because once a tendon or muscle is injured like that, the protective contractile response is turned up a lot, right? And it's hard to let go. And so a deep tissue or myofascial work on that can help temporarily interrupt that myotatic reflex.
Is that a form of the transverse?
Yeah, what transverse just means cross friction massage. You're going across the fibers in a perpendicular way. It's not any better than just just the pressure of inhibiting that myotatic
Okay.
reflex. It increases blood flow and it's helpful, but you do that first and then you do your gentle eccentric loading. And then what specifically to do depends on their tolerance at that point and how long the injury's been present and so forth. I had our student start super super gentle, and we just slowly progressed her, and she's doing
Mm.
really well now. But you got to be smart about it. But so a good sports medicine physical therapist would be worth their weight in gold on this. So you don't need to do
Mm.
PRP, and that's why
Okay.
it just pisses me off to hear a doctor allegedly say that.
What so just to wrap up this question,
And
and before
the glute medius too, we didn't even get into. So that's that lateral hip stabilizer on the side. The ensthesis is where the actual tendon inserts on the bone. That's what that is.
okay.
Yeah. So,
What's with the no bruising?
so sometimes it depends on how much blood there is in the tear. You saw what my leg looked like. It was black, right?
Yeah.
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 And that was a ton of bruising from the actual bleeding of the tear. It depends. Sometimes it depends on the degree of the tear, how much tissue the person has, whether you can actually see it coming up through the skin.
Okay.
It varies. It varies. But
So maybe
typically,
they'll have some swelling,
yeah,
but not actual bruising. Okay.
it could be. It depends on location, right? So yeah,
Mhm.
it's a good question. So the bottom line is to this person, find yourself a good sports medicine oriented physical therapist, and they'll take good care of you.
Okay, that was gonna be my question is to wrap that up,
Yep.
what can they do? Like, is K-tape gonna help a little bit, or no, it doesn't even matter?
So kinesia tape, whatever brand it is, KT tape,
Yeah,
rock tape,
yeah.
whatever, it provides a proprioceptive input to the brain, a position sense. It helps with the myotatic reflex. It can be very helpful as an adjunct, but it's not going to replace proper rehab. And it's really important that you do that because you're going to set yourself up. If you don't, while it's healing, if you don't give it the right inputs, you can have improper collagen deposition in and then form what's called a tendinopathy long term, and that's not good. It just won't stretch and won't work as well. So get
You were
yourself.
telling me about that with one of my injuries.
Yep,
I can't remember which one, but yeah.
yep. So the easy thing is find yourself a good sports medicine oriented physical therapist who also has some manual medicine skills, and you'll be good to go.
Another question, which is going to be another injury prevention slash injury recovery, is ways to strengthen and prevent intercostal muscle injuries or strains in your ribs. Maybe specifically this upper area, right, you know, next to the just below the pec, um, breadbasket, rib area, but you can talk in a whole sense,
Yep.
but also maybe that.
Yeah, so the intercostal muscles start way in the back itself. So the costal just means rib. Intercostal means between ribs. So the rib goes from the thoracic spine and wraps all the way around the front. The top portions of them, they uh, join up with the sternum, and then you have several floating ribs that don't have a direct bony attachment. They attach to cartilage. So the muscles, the intercostal muscles are between those. And the biggest thing you can do for prevention is thoracic mobility work. A lot of people have very poor thoracic mobility. We did a warm up in class about a week ago where I had people get into the frog stretch position.
Hmm.
Um, and then I had them put,
Oh,
yeah,
the
not even that. I know what you're saying, the reach through, but this one I had you can do that too. You can reach the opposite arm underneath you, try to rotate to the ceiling because the frog stretch position basically locks out the lumbar spine. And all your rotation is going to have to come through the thoracic and cervical, especially the thoracic. And a lot of people are really tight, and thoracic mobility is a real issue. And so,
Mhm.
where I usually see these intercostal strains or rib injuries, or let's say someone has their back in like a body triangle, and their waist is locked out, and then they try to do this rapid twisting thing, and they don't have the thoracic mobility, and it kind of locks down on them. You can strain it pretty good. And also the things that attach to the ribs, like the obliques, internal, external oblique, and stuff like that, can also get pulled. But some thoracic mobility exercises. There's a ton of them out there on the internet. Would be a really
Any
good.
resources you'd point them to?
Uh, the- there's some good ones and bad ones. Specifically, I have a couple that I like. The ones I like are just when you really do lock out um, the lumbar
Anyone
spine.
on YouTube or anything
Yeah,
that you would like point them to?
remember that pretzel stretch I was having people do too? Where you laid
Pretzel
Yeah,
stretch.
you lay on your back, on your side, and you have one knee up, and then you kinda
Oh
breathe
yeah,
and yeah.
it's almost
So,
like a beauty queen kind of stretch, but you're
side
actually laying down, and
and you basically use your breath in, and as you exhale, your arm pulls your torso back to the ground.
this is this one here.
Yeah, yeah,
So let's say I'm laying on my right side,
yep,
and then I can have my arm straight out, my right leg straight,
and
my
your
left leg, which is my top leg, whoops,
is
is
bent.
going to be
Yeah, bent,
at like a 90.
and with that knee on the ground,
Yep.
and then
Inside of the knees on the mat or ground, and
yeah,
then we start to just open up,
the opposite way. Yep,
and and you're gonna find like I have pretty decent thoracic mobility, but go slow.
yeah,
Feel the kinks, kind of sit there, live in there, live in that kind of tight range, and then you can start to exhale and go back and hold. You had us doing that for quite a bit. I think
Yeah.
for this guy especially, he's another local guy down here
Mm.
actually, that I train with, and he's in between our age, and but I've heard these questions come up with other people: is how can I just strengthen that? You
It's not a
know?
strengthening thing, man. It's usually gotten adaptively short. Yeah. Yeah. Now you
Mm,
can do some, um, if you want to prevent, there's some anti-rotation exercises that are good for the spine in general for spinal
mm,
stability, like the pull off press and things like that. There's a lot of anti-rotation where you have to resist the pull into rotation. I've shown you a couple of those before.
yeah.
Yeah.
What about the band work? We have a
That's what
couple
I'm
of those
saying. That's
workouts
what I'm saying, the pull off
where
that's the pull off press.
okay, that's what that is.
Yeah,
Okay.
so the band
Oh
is
yeah. Well,
yes, yeah, yeah, that's anti-rotation. So there's a
check out our YouTube page. We have some workouts in there. We have a playlist with workouts.
yeah.
So for people that are interested in how to,
Um,
like you said, it's not necessarily strengthen.
well, and if you get some good mobility, something you can use to strengthen that has a really that makes you go through a good range of motion, especially thoracics, is Turkish get-ups. So that's a good one you
Mhm.
could do. Another good one you could do is the kettlebell windmill. That's another kind of
Okay.
rotationary type of thing for stability and strength. So that's a good one too.
What about the what's the one called where you're locked out and you're doing the kink? I'm pitting out, but and you do that kink and you got your arm all the way up there.
Yeah, that's the kettlebell windmill.
Oh, that's the windmill.
Yeah,
Okay.
yeah.
Um, I was mixing that one up with the where you go between the legs and you bring the kettlebell up and then you go between the leg.
No.
Yeah. Okay, so windmill workout with the kettlebell also quality. How about someone that's already got potential injury there,
Mhm.
or is it going to be the same thing?
Yeah, but you gotta be careful with that because, again, we have that myotatic protective reflex, and that's where, working also with a deep tissue massage therapist and then getting your stretching in after that, would be j
Okay,
just take it easy. Yeah, the
red
biggest thing
light.
is the big no. The biggest thing is people
No,
what oh, I'm sorry. You mean actual red light. I thought you were
yeah, red
being
light
goofy.
therapy.
Yeah, red light, near infrared, is actually really good for increasing blood flow, decreasing inflammation. I think that's a good one too. Yep.
Uh, is this going to be similar to the costochondritis kind of stuff? So
Yeah.
like heat can help
Yep.
if you're having some pain in there.
Well, costochondritis is just the inflammation of the cartilage at the attachment of the ribs, typically to the sternum.
Mm,
The costochondral
okay.
junction. Yeah. Costo
So
means
okay,
rib,
it's
chondral means cartilage. So where the bone meets the cartilage is where you get
okay.
costochondritis. Yeah.
Okay. So some of these rehab things can help with that. So
Big time.
if they're going to um initial things, if they already have the injury, what would you say? Where do they start if they already have some injury in
It's going
there?
to be
Maybe it's
time.
not severe. They can still roll and stuff like that, but they're like, oh, I'm
Well,
pretty sore.
then you gotta be really careful about doing crazy, high torque twisting movements, especially like I said, when you have someone has your back or, has you in a body triangle and has immobilized
Or
your
side
hips.
smash. If they're getting side smashed and they're twisted
Same,
up like
yeah, not to try to muscle out of that. Yeah, exactly. Those are the type of things where you can get injured. If it's a pull, heat is your friend on this for sure. Um, and there is some kinesio taping that can actually make it feel a little better. Um, but it's just a little
would you
time.
go down the rib on that or would you
No,
go around?
I typically follow the muscle itself. I follow it um, circumferentially. You could. It depends on what you're taping. There's so many people. There's so many taping. You know, there.
Oh, right.
Yeah, I mean, there's so many. What muscle groups are we talking about?
Mm,
Yeah.
mhm.
I mean, in general, I think ribs though can take a long time because, you know, especially if people have this very dominant thoracic breathing pattern, you like a stress breathing pattern. They're constantly
Yeah.
messing with it. Yep.
Okay. Okay. No, I think that's great stuff, and I think they're going to get a lot from that, especially on how to, like you said, not necessarily strengthen, but increase mobility, functionality of the core to prevent getting injured.
Well,
That's going to be good.
mobility by our definition is strengthening as well too, but I'm just saying you have to create some range of motion first before you actively start strengthening that range.
Yeah.
Yeah.
You just turn on picture in picture on your video there.
No.
Yeah, you did, you little dirty dog.
Oh.
I can see you up in the top right.
Oh, well, there you go. It must have been on. I didn't turn it on. So it must have
Oh,
it,
okay.
yeah, that was weird. ATEM,
Um,
ghost in the machine.
yeah. Well, with that, why don't you go and hit that outro music? And if people have any questions like these, grapplingwithpodcast@gmail.com is a great place. You can send questions. You can also just DM us on Instagram. You can make a comment on YouTube. Other than that, that's all we got. You got anything else there, Chris?
I do not. Thanks for being patient with us with all our technical issues.
Yeah, we're trying to get better every single time. So send us questions if you got them. Other than that, we'll see you guys next time.
All right, later.
You keep that volume up, you son of a gun.
What volume?
You don't want to kill that. You don't want to kill the outro music.
Oh, I killed it.
You son of a gun. You gotta let it play.
Well, I didn't know how long you wanted that.
Well, I want to go to sleep.